outbreaks of novel virus infections are a public health concern that require our collective efforts to respond. Just briefly, the cases of this newest virus have been confirmed in several countries, including the United States. As of Monday, February the 3rd, the CDC has confirmed 11 cases in the United States, all of which have been associated with travel to China, including one that was the onset of which was in the United States, but occurred in an individual who was a close contact of someone who had traveled to China. At this time, there are no cases identified in South Carolina. The possible risk of 2019 nCoV infections in South Carolina depends on several factors. That is the likelihood of exposure here, which is related to the likelihood that travelers from impacted areas will expose individuals in South Carolina, and also how easily the virus may spread from person to person. And there are other factors that are still unknown that are being researched through cases that are being identified internationally. But it's important to remember that the 2019 nCoV virus is not widespread in the United States at this time, and the CDC continues to believe that the risk of ongoing transmission in the United States is very low. CDC and DHEC are mounting an aggressive public health response to make sure that we can identify cases, that we can immediately isolate, and that we can prevent ongoing spread in the United States. And I want to reinforce how important it is for DHEC and you all to collaborate in our response to the 2019 nCoV virus. Some of that work has already begun, and among the things that we have done include that we have communicated information to hospital laboratories, to healthcare providers throughout South Carolina through our Health Alert Network, and to infection preventionists and physicians to keep them informed about how to identify cases, how to report them to the health department, as you have an excellent example given here this morning. And we held a telebriefing with hospital public information officers across the state, providing them a status update of the outbreak. And from our communications staff, we have a very close working relationship to continue those updates. So DHEC is here and available to assist you in any way possible as we deal with this emerging health threat.